Best of Health, presented by Clarion Health, Methodist, IU, and Riley Hospitals.
This week, Dr. Kate Kling will be answering questions concerning eating disorders, starting with, what are eating disorders?
Eating disorders are a severe problem with being able to take in a normal amount of food and maintain a normal body weight.
What are the most common types of eating disorders?
Anorexia and bulimia are the most common types. Anorexia is not maintaining a minimum body weight for size, or maybe less than 85% of body weight, being extremely afraid of becoming fat, believing that you are much larger than your body size actually is, and for a woman being unable to maintain a normal menstrual cycle. Bulimia is taking in a huge amount of food in a very short period of time and then getting rid of it in some way, vomiting, using laxatives, over-exercising, or fasting. The third eating disorder is one that is really being defined now, and that's binge eating disorder. Those people tend to be of somewhat larger body size. They binge, they take in a large quantity of food, but they do not get rid of it.
What effects do eating disorders have on a person's health?
People with eating disorders have the highest rate of death of any psychiatric disorder, so that's the most severe. But less severe, they can affect heart function, they can affect ability to think clearly, to remember things, to have motivation. Those are effects of starvation.
How can you tell if someone has an eating disorder?
It's difficult to tell if people who are bulimic have an eating disorder because it's a very secretive disorder, so you can go for years and not really know. People tend to do those vomiting behaviors and whatever in private, and they maintain a normal body weight. So with them, you can only tell often if they tell you, or if they may get really depressed, or you may find out that someone's vomiting. With people who are anorexic, the most evident part is that they lose a tremendous amount of weight.
How can friends and families help young people recover from an eating disorder?
I think they can be helped by having people pay attention to what we tell young people, that it's more important to develop who they are rather than that they meet a certain body size.
What does the Caris Center offer to people with eating disorders?
Because these are such complex disorders, they require a treatment team. They require a physician because there are so many medical problems, a psychologist because there are many psychological issues and you have to teach them how to think differently about their bodies and about eating. And then a dietitian because it's hard to remember how to eat in a healthy way, so the dietitian retrains that part of their life.
For more info on the Caris Center, call 317-295-0608.
For more information on this or other health topics, visit clarion.org or call 1-800-265-3220.